I'd like to start by acknowledging the traditional owners of the land on which we meet and elders past and present, and any Aboriginal and Torres Strait Islander people in the room. I was asked to talk about adult immunisation, and I'm going to kick off by talking about Mother's Day because it's my mum's day to celebrate tomorrow, and I'm sure it is for all of you in the room in various fashions. This is a picture of my daughter with her mother's group, as mothers groups do in Darwin, standing out in the sunshine or having a ball. And my granddaughter here, who it looks like is saying Happy Mother's Day, Mum, and giving her a kiss, but of course that's not what she's saying. She's saying, thanks for getting a flu vaccine in pregnancy, Mum. And what I'm sure, as an epidemiologist, I'm used to dealing with population numbers in the thousands. I'm going to give you an N of 1. When my granddaughter was 6 weeks old, her dad got laboratory confirmed influenza, and he was very sick, off work and at home. My other daughter, so Olivia's auntie, also got influenza. Olivia didn't get influenza. Her mum had a flu vaccine when she was pregnant. Now that's an N of 1, but we were pretty happy that at 6 weeks old, Olivia didn't get flu, which would have been pretty serious for her. I'm going to go through and throw a whole bunch of numbers at you, but when you think about immunisation, it's actually about people, and it's not so much about the numbers, it's about providing protection and trying to prevent people from getting sick. And the same stories as when kids were going through their picnics. The strategy there is about trying to prevent illness in those infants. We do it a little bit differently, as I say, these days. But my email address is here on the bottom. If anybody wants to email me, I'm always happy to have a chat about vaccines. I don't have any connection with vaccine companies or industries. I have no conflicts of interest to declare. There is one more Happy Mother's Day present for those of you who might not have picked it up in the budget. There was $42.5 million announced on Tuesday for vaccines, new vaccines to be added to the National Immunisation Program, and amongst those is funding of a vaccine for pertussis vaccination in pregnancy. Currently, pertussis vaccines have been funded by individual states and territories, and as of the 1st of July, it'll be on the national program and it'll be free. Why that's important is that it's no longer a year-to-year budget proposition with depending on whether your own state or territory decides to include that in their budget. It fits in the fully funded national program. Now, I was asked to talk about adult immunisation, so as a boy who's used to doing what he's told, I'm not going to do that. I'm going to talk to you about just two vaccines, influenza and pertussis, in pregnancy. And I know that most of you had a pretty tough night last night, so I'm going to keep it pretty simple. This is the concluding slide. So for influenza vaccine in pregnancy, it's recommended at any stage of pregnancy if you're going to be pregnant during the flu season, whether you're in the first trimester, second or third trimester. If it's flu season or coming into flu season as it is right now, then the vaccine is recommended. And key elements of that is that vaccine providers have a conversation with mums, tell them about the vaccine, why it's recommended, offer the vaccine, and if mum wants it, give it. So it's recommended, offer it, give it. They're the simple messages around flu vaccine, and I'll highlight to you that that simple strategy is not working at the moment. We're not getting anywhere near the number of women getting access to a flu vaccine in pregnancy than they should. For pertussis vaccine, flu vaccine is recommended in pregnancy to protect mum during her pregnancy, but also with a spin-off effect to protect the baby during the first early months of life. Pertussis vaccine, the recommendation is really recommending pertussis vaccination in the third trimester of pregnancy is really giving that baby its first dose. So instead of giving it a dose at 2, 4 or 6 months, the first dose in pregnancy provides early antibody protection that transfers through the placenta to the infant, and that's the strategy. So we're looking to vaccinate mums in the third trimester. Yes, it has a potential to protect mum from getting whooping cough in that third trimester, but it's really a strategy to prevent pertussis in the first few months of life when it's most severe and where we see deaths when they do occur. I'll tell you a little bit more about that later. Now, I am on the clock, so I think Jean might have to tell me to shut up and drag me off, because even though I've got one slide, I'm going to add a bunch more for those of you who are still awake. I just want to start to tell you a little bit about ATAGI. So I chair the Australian Technical Advisory Group on Immunisation, and really our job is to provide evidence-based technical advice on vaccine use. So that's vaccine uptake, vaccine safety, and vaccine effectiveness. Who do we provide that advice to? It's essentially to the Minister of Health, but we do that through the Commonwealth Health Department, and we provide advice to the Pharmaceutical Benefits Advisory Committee, called PBAC, and they're the group that provide advice then to the Minister about vaccines coming on to the National Immunisation Program. So I'm going to give you a little bit of a potted history, but the announcement on Tuesday that Pertussis vaccination's going to be in the National Immunisation Program came off the back of a positive recommendation from the PBAC. That came off a company making a submission to PBAC and ATAGI providing advice to the company and to the PBAC about whether what the company's claiming is true, or what kind of a appropriate strategy would be there. So that's the last you'll hear from me about ATAGI, probably until the next slide. Now this is a slide that I pinched off Lisa McHugh, who happens to be my wife, so it was or I happen to be her husband, it's probably more appropriate. And this is a very potted history about flu and pertussis vaccination in pregnancy in Australia. The first time that reference to influenza vaccine in pregnancy turned up in the National Immunisation Handbook was in 2003. It had actually been recommended prior to that and sat within the Pharmaceutical Benefit Scheme system, but if you say our immunisation handbook's our Bible, it first appeared in 2003. 6 years later, 2009, we had the influenza pandemic, and then we come forward to more recent times. In 2015, pertussis vaccination was first recommended in the handbook, and in 2016 there have been worldwide trials on a new vaccine for respiratory syncytial virus in pregnancy, so it's another vaccine that's likely to come in the space of potentially vaccines available for women in pregnancy. And it wasn't that long ago, I'm sure most people in this room would have had the view that you don't give vaccines in pregnancy, that nobody gives vaccines in pregnancy. Well, in fact, that's not the case. It has been recommended for a long time, and it's probably a strategy that's going to be used more frequently as more trials come down the pathway. But there actually is a little bit more to this story. I'm going to make a few chicken scratchings on this slide to update you on the history. Flu vaccine was first recommended actually in 1960 by the US Surgeon General, saying that pregnant women should get a vaccine against influenza during pregnancy. In 1997, ATAGI, the group that I chair, was first formally established. There had been other settings before that. And in 2005, we had a new process for getting vaccines on the National Immunisation Program, which required a positive recommendation from the PBAC. Now, why that's important is the Health Minister can't agree to put a vaccine on the National Immunisation Program. Under legislation, he or she can't agree unless she has a positive recommendation from the PBAC. Now, in other countries, the system's different. In the UK, if the ATAGI equivalent makes a recommendation, it's seen to be an equity issue, a right, and so it becomes automatic. In Australia, it's a system that says the minister can't say yes unless the PBAC says yes, but if the PBAC says yes, the minister can still say no. So it's just a kind of check in the system. And what that really means is potentially some pretty long lag times in between recommendations and things coming through. So if we just look now at what happened around the time of the influenza pandemic, a lot of people thought that the pandemic was not severe, that there were a lot of cases, but it was clinically mild illness. It wasn't the case for pregnant women. There were deaths worldwide, a number of deaths worldwide during the influenza pandemic, and 30 to 50% of those deaths occurred in women of childbearing age were actually pregnant. So if you look around this room or walk anywhere and if you say women of childbearing age, do I think 30 to 50% of women at any one time would be pregnant? Of course, that's not the case. It's a much lower percentage. So pregnant women were overrepresented in the deaths that occurred at that time. When we looked at whether people had received a seasonal flu vaccine, not the pandemic strain around that time, we did some work in the Northern Territory and coverage was pretty much zero. So we found 2% of women that had a flu vaccine coming into that time. Data since around Western Australia and other places everybody's found up until 2009 coverage was less than 10%. So nobody was getting a flu vaccine when it had been recommended for the best part of a decade. Since 2009, we did a survey immediately post then, and we've done another survey, cohort study I'll tell you a little bit more about, from 2012 to 2006, and coverage for flu was around 34%. So it's still really low, better than 2%, but we've only got roughly one mum in 3 getting a flu vaccine in pregnancy. So pertussis vaccination, I'll just switch to that now. That was first recommended in the Australian Immunisation Handbook in 2015, and in July, so 2017, so nearly 2 years later, it came up on the PBAC agenda for discussion, so that a company that's made a submission, ATAGI, had provided advice. A year later, there was a positive recommendation from the PBAC, which was in March 2018, and then in the fastest move I've ever seen, a few months later it was funded. So from official public recommendation through the PBAC minutes, it should just come out as funded as of Tuesday, funded from the 1st of July. So what about the evidence base of vaccines? Do they work? For influenza vaccine, thinking now not about its protective effect against mothers in pregnancy, but its protective effect for the infant, there have been a few studies, a few randomised trials. The first one was done in Bangladesh, and women were randomised during their 3rd trimester to either get a flu vaccine or a pneumococcal vaccine in pregnancy, and then were followed to see whether they had laboratory confirmed flu, amongst other things. That study found vaccination in pregnancy had 60% lower risk of influenza if you were vaccinated in pregnancy for that baby than the baby who didn't receive a flu vaccine in pregnancy. So that's good. You'd much rather have less risk of getting flu in those first 6 months. Since then, there has been a large study done in the US, 250,000 people over a prolonged period of time, found similar results, around about 70%, and a systematic review that's pulled all the data from various studies together had about 50% effectiveness against laboratory confirmed flu, higher effectiveness against laboratory confirmed flu where it was severe a disease in terms of hospitalisation. There have been a number of studies done on safety. Up here is a study that we've done amongst 7,000 mothers and babies across Australia, and we found very similar rates of preterm birth between the infants of vaccinated mothers and the infants of unvaccinated mothers, and similarly no difference in relation to birth weight or small for gestational age. So we didn't find any indication that vaccination was making things worse in terms of birth outcomes for the baby. Just in the last few weeks, there's been another study published in the Paediatric Infectious Diseases Journal, which has collated data from 3 different trials of influenza vaccination in pregnancy in Nepal, Mali and South Africa. And here the outcome they were measuring was severe clinical pneumonia. So it wasn't confirmed whether that clinical pneumonia was due to influenza or not. And interestingly, when they looked during the flu season, when flu was circulating, there was a reduction in severe clinical pneumonia for the babies whose mothers had been vaccinated compared to the babies whose mothers hadn't been vaccinated. So that's in the order of 37%. So it's a non-specific outcome, but less risk of severe pneumonia. That's a good thing. When they looked in the same study group and said, well, what about if we look at a time of year when there was no documented influenza circulation? So the clinical pneumonia that's occurring then is much more likely to be due to something else other than influenza. No evidence that the vaccine's effective, and you wouldn't expect it to be. So you wouldn't expect flu vaccine to prevent pneumonia that's not related to flu. So that's a really neat study that's just come out. For pertussis vaccine, I'm just switching now to add some information on pertussis. This was really almost a natural experiment. In the UK, they had a very large epidemic of pertussis that they weren't getting on top of and weren't able to control, and they introduced population-wide free pertussis vaccination for women in pregnancy and then monitored the effect. Now that's a very unusual thing to do, and I was chair of ATAGI at that time, and that's not something we would have done. But in the UK they said this is an epidemic, this is what we're going to do, and they did that and monitored the impact with a number of really neat studies, and they found the vaccine was highly effective in preventing whooping cough in the babies in the first 3 months of life, 90%. And now there's been another study followed up in the US with a much larger cohort since they've introduced the program there, 75,000 people, and they found vaccine effectiveness 80%, 85%. So really both these scenarios are saying the evidence is there. Flu vaccine works in terms of preventing influenza in the infant, pertussis vaccination works in terms of preventing pertussis vaccination in the infant, and that's the sort of main take-home message. If we think about the disease burden, for pertussis in infants under 6 months of age, these pertussis epidemics tend to occur every 3 to 5 years. For influenza, we have epidemics every year, but they vary in severity. So we would see, on average, this data's looked at notification data for 4 years, about 300 cases of lab-confirmed influenza in infants in the first 6 months of life, and for pertussis, similar kind of numbers, about 237 is our average over that period, 1998 to 2012. What that means in terms of clinic presentations for flu, if it's a moderate to severe year, we'd see around 400 hospitalisations a year, probably 30 to 40 of those admitted to ICU, and a death every second year. For pertussis, 500 hospitalisations, 40 ICU admissions, and 2 deaths a year during epidemic years. How am I tracking for time, June? 5 minutes? Okay. Right. Okay, so I've got 5, it's all right. I'll do a quick 5-minute summary of a study that we're doing nationally. It's called the FluMum study, where we're recruiting 10,000 mother and infant pairs, and we have already completed this collection, mother-infant pairs across Australia. This is not industry sponsored, this is National Health and Medical Research funded study with researchers from every academic institutions in 6 states. These are the hospitals that we work through in Adelaide, Brisbane, Darwin, Melbourne, Perth and Sydney. And really what I want to do here is just highlight to you what we found in terms of who was receiving influenza vaccine each year and how much. So this graph shows you at the top of the bar says in 2012, 33% of the pregnant mums in our study had received a flu vaccine. It was 31% and 37% if we go 2012, 13, 14. Now we look at, if you were vaccinated, what trimester did you receive the vaccines? Remembering flu vaccines recommended at any stage in pregnancy. We had a small number of mums, a small proportion of mums receiving a flu vaccine in the first trimester, but most, if we had a date of vaccination, was actually in the second trimester, and then some in the third trimester, and then some, about 25%, where we didn't have a date, so we couldn't confirm that. In 2014, we also asked about pertussis vaccination. At this stage, pertussis wasn't funded, and only 3% of mums said they'd had a pertussis vaccination during their pregnancy. 2015, there was a national recommendation, and every state and territory had their individual programs funded. What happened was pertussis vaccination in its first year went from 3% to 46%, so nearly half of the mums had had a vaccine against pertussis in their third trimester, and that, with it, brought a jump in flu vaccine uptake from 37% up to 45%. And the big shift is here, that most of these people who are getting a flu vaccine are getting it in the third trimester, and we think that's because their provider is giving them a pertussis vaccine and talking about flu at the same time. So it's a win-win getting both vaccines to people, but still a way to go. Interestingly, we looked at what date, regardless of the year, when we were actually getting a flu vaccine. And what's concerning here is that before pertussis vaccine was available, 8 out of every 10 mums who were vaccinated were getting it by the end of May, but pretty much none of these mums who were pregnant were getting the vaccine after May. So people switch off thinking about flu vaccines after May. In 2015, when we looked at pertussis, the same story. It's still 8 out of 10 who get vaccinated are getting vaccinated by May. And I think if there are conversations amongst you in the audience, I think most of you would probably feel that that makes sense, that people just stop talking about flu vaccines in June, July and August, and they think it's too late. And it's not for pregnant mums. It's in fact not for anybody. If you're coming up to the flu season and you haven't had a flu vaccine, and getting a flu vaccine is still a good idea, but for pregnant mums, it's a real worry for us that people are stopping talking about flu vaccine in pregnancy after May. I'm going to be a quick snapshot of what are the things that influence whether or not you get a flu vaccine in pregnancy, and these won't surprise you. 65% got a vaccine if their GP recommended it, compared to 27% who didn't. And so really, if you just scan down here, these proportions are saying what are the drivers of getting a flu vaccine? It's your GP recommends it, your obstetrician recommends it, your midwife recommends it. We asked about other people recommending it, but really your practice nurse would fit in the same barrel. I wish in hindsight that we'd had a specific category there. Every time I present this, I cop a bit of flack from nurses in the audience about that. If you'd had a pertussis vaccine in pregnancy, you were much more likely, and if you were somebody who gets flu vaccine regularly. Then the things that we asked Mum about what she thinks, and this won't come as a surprise. If Mum thinks that getting a vaccine in pregnancy stops her baby from getting flu, she'll get vaccinated. If she thinks that means that her baby she'll have less severe flu herself in pregnancy, she'll get the vaccine. If she thinks it could make her sick, she's less likely to get the vaccine. If she thinks that getting the vaccine is worse than getting the disease, she's less likely to get vaccinated. If she thinks that it could harm her baby, she's less likely to get vaccinated. So these are things to talk about with mums because they're influences. So this is my second last slide. So if making a list of enablers and barriers, the real enablers are you. So you talking to mums about vaccines in pregnancy is really what makes a big difference to mums getting vaccinated, flu or pertussis. If mum has other vaccines in pregnancy, other vaccines generally, she's more likely to get it. And if she thinks flu in pregnancy is serious and that the vaccine works, she's more likely to get it. And the things that stop it is that people aren't recommending it. The date of the year stops it, which is bizarre. You shouldn't stop getting a flu vaccine after May. And mum's own concerns and importance of safety and effectiveness of the data and monitoring this through the Australian Immunisation Register remains a priority. So last slide, this is where we started, the report card. What you should be doing is recommending vaccines based on the evidence in pregnancy. If mum wants it, offer it and give it. And the same for pertussis. If I was giving a report card like I got during my school days, looked very much like me. C+ can do better. Usually Ross talks too much. B+ is a good start for pertussis. Now, I think a message that people often forget, particularly for flu vaccine in pregnancy, it's hard because flu vaccine is about being pregnant during the flu season and giving a flu vaccine there. Unless you live in the tropics, the message I'd encourage you to say is every mum you see between Mother's Day and Father's Day, you should have a conversation about getting a flu vaccine in pregnancy and offering it. So you're pregnant, think Mother's Day, Father's Day, get a flu vaccine. Okay, thanks.
Thank you, Justin.